Thank you very much, Mr. Chairman. Dr. Riuis, as you know, we're here today to examine how the FDA regulates over-the-counter drugs like sunscreen and identify areas for improvement. With skin cancer rates on the rise, consumers need broad access to these protective products. In my district in Western New York and the southern tier counties, melanoma incidence rates are among the highest in New York State, soaring almost 64% above New York's average and 25% higher than the national average. Given these alarming trends, ensuring the access to affordable and effective over-the-counter of sunscreens, the most effective products that we can put forward in skincare, is a public health priority as far as I'm concerned. However, time and again, FDA regulations have stood in the way of innovation and evolving science. Dr. Rius, given these challenges, what steps can the FDA take to modernize its regulatory framework to ensure Americans have access to the most effective and up-to-date sun protection products?
Well, I think the situation we're in right now is unacceptable. There are only two ingredients that are generally recognized as safe and effective, right? And these ingredients put at a disadvantage people of color, in that people of color do not want to have a white cast on their skin and therefore won't use it. So they're more susceptible to getting skin cancer. Imperatively, we need to change the system to bring more innovation and to protect all people of different skin types, melanin, rich or not. And providing FDA with the information in terms of what's going on in the rest of the world in terms of how they regulate, sharing that, bringing in the new science, which is already being used by other government agencies in the United States, such as EPA, such as the Center for Food, Drug, that is the most important thing we can do in terms of protecting our people. And in New York City, I'm in New York, I grew up in New York City, so I appreciate that. We need to do something about it because skin cancer is the largest cancer in the United States with the most prevalence and the most morbidity and mortality if it's not treated. And the beauty of it is that it's preventable, right? So if we can prevent instead of treat the disease, we're in a much better state altogether. So I think that's kind of my view.
Very good. On to quality assurances, Dr. Menzel, like the supply chain for prescription drugs, the over-the-counter supply chain is complex. It requires raw materials, active pharmaceutical ingredients, inactive ingredients from sources all over the world. Consequently, quality assurance in this area can be complicated, and over the past few years, we've seen a number of quality-related import alerts for over-the-counter monograph drug products. Mr. Menzel, what do you see as the most significant quality control challenges faced by the over-the-counter manufacturers, and what opportunities do you see for AMUFA 2 to focus on strong quality controls that can address these issues?
Yeah, I would say, first of all, I think the industry as a whole regulates themselves very effectively. As I mentioned, I started out as a very small company, but we're proud that we have no quality issues and self-regulate very effectively. We monitor batch releases for all the products that are released to make sure that everything is safe and effective before it gets released. And that's the situation, I think, with the high percent of companies that are being represented here by CHPA. I do think that one of the issues are these manufacturers that are in arrears. That's an easy target list that should be targeted. Typically, the companies that haven't paid their fees are also the companies that are having these quality issues, and so that would be an easy target list. As mentioned, this could be published. It could be an initial target list that the FDA could go after to monitor facilities and determine if they're actually meeting quality requirements. But I would say overall the quality system within the FDA is first in class. It's a gold standard, and companies that adhere to those have maintained safe and effective products for the U.S. consumers.
Well, thank you very much. Modernizing regulations and strengthening quality control are essential to assuring the safety and accessibility of over-the-counter drugs, and I look forward to working with my colleagues here on the committee to reauthorize AMUFA, and I thank the witnesses for being here today, and I yield back, Mr. Chairman.